Good afternoon. My name is Alina Siraeva, and I'm co-author of the work Modeling Ischemic Stroke by Occlusion of the Anterior Cerebral Artery in the Mini Pigs. And today I will present it to you. The therapy of acute disorders of the cerebral circulation is one of the most urgent medical problems. There is no effective treatment protocol for cerebral stroke in practical medicine. Preclinical trials have results obtained in small animals, it is rodents, but this cannot be projected into the humans. Therefore, there is a need of preclinical studies in large animals whose anatomy, physiological, and biochemical characteristics are close to humans. There is no method of recreating a standard cerebral infraction focus or focal volume with abnormalities characteristics of the ischemic brain area in large animals. The development of a model will allow the preclinical testing of new drugs with the assessment of their effectiveness on the recovery of penumbra and skills. The aim of the study is to create an optimal mini-pigs model protocol. Mini-pigs weighing 15 kilograms were used to model ischemic cerebral stroke. Animals were anesthetized with Zolitol 3 milligrams per kilogram AM. Animals were connected to an inhalation anesthesia machine via wishes of around in 2.0 till 2.5% mixed with oxygen was administered. All surgical manipulations were performed in accordance with aseptic and antiseptic rules. Then, to reduce the blood flow in the circle of Phyllis, right carotid artery was ligated. You can see this on the first chemical picture of a pig. Through trepanation in the left parietal bone, a operative access was created to the anterior cerebral artery. After trepanation, the dura mater was dissected and the distal branch of the ACA was categorized by electrocoagulation under an operating microscope. On the second pictures, you can see the brain and artery. This is the place of occlusion. In the postoperative period, all animals received antibacterial and analgesic therapy. 10 days after the modeling stroke, mini pigs were anesthetized as previously the brain was extracted from the cranial cavity and post-fixed in 4% paraformaldehyde solution. 1 day after fixation, the brain was delivered, photographed, and then was sliced into 3 mm thick slices, and each slice was photographed for analysis of infect area. All morphometric analyses were performed in ImageJ software. Morphological analyses revealed small focal ischemic brain infection localized in the left parietal lobe. Areas of cortical infection in peak 1, 277 square centimeters, peak 2, 309 square centimeters, peak 3, 729 square centimeters, peak 4, 532 square centimeters. Analysis of histological examination revealed characteristic and reproducible morphofunctional brain abnormalities 10 days after surgery. The results of the study indicate that this method of simulation cerebral stroke in the mini pigs allowed the creation of a focal volume ischemic cerebral infraction affecting the left parietal lobe in the experimental animals. This study was supported by Russian Science Foundation. That's all. Thank you for your attention.